his respiration is unlabored. He does have expansion of the thorax is equal on both sides. Next, I'm going to do the palpation. Going to palpate the anterior chest, feeling for any lesions, any tenderness. Okay. 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 I am also, while I'm palpating, I am going to check the tactile firmitus. Okay. I want you to say 99.
99.
Okay. 99.
99.
Okay.
99.
Okay. All right. So next, I am going to auscultate the chest area. I'm sorry. I'm going to do the percussion on the chest, and I'm going to move from side to side so that I am comparing bases on both sides. Okay. On percussion, I'm feeling for resonance. Normal sounds or resonance. I am also feeling for any dullness, any hyper resonance. Those are not expected sounds. The percussion sounds are great. Resonance, and I am next going to auscultate the chest area. I'm auscultating his lung sounds. Okay. Lungs are clear. There are no crackles, no rhonchi, no abnormal lung sounds. Now I am going to move to the posterior chest. I'm going to have you turn to the side. Again on the back area, I am inspecting, looking for lesions, looking for skin changes. I am also going to palpate. Okay. And on the back, I'm also going to do percussion, checking tactile firmitus. Say 99 for me.
99.
Okay, 99.
99.
Okay.
99.
Okay. I'm looking for respiratory effort, non-labored, even thoracic expansion. I am also going to check. I'm also going to check the thoracic expansion by placing my thumbs on the 10th thoracic vertebrae. Take a deep breath in. And breathe out. Okay. And doing this, I'm looking for an equal movement of my thumbs and my fingers. That tells me that both sides are equally expanding, and that's present. That's present in this patient. Next, I am going to check diaphragmatic exertion. To do that, I'm going to palpate. I'm going to do percussion till I feel sound changes. Okay. Okay. And then I am going to mark where I feel the sound change. I'm going to mark the change. I'm going to mark that point. Start at the bottom. Okay. Auscultate till I feel sound changes. Okay. Then I'm going to measure that area. I'm going to measure that area, and that is 2 to 3 centimeters, and that is a normal finding. Okay. I'm also going to auscultate the posterior lungs. Listening for normal sounds, identifying any abnormal sounds. Okay. I want you to raise your arm up higher. Okay. I am also going to auscultate the lateral lungs. Okay. All right. Going to auscultate the lateral lungs on the left side. Again, hearing for normal and abnormal sounds. Okay. No abnormal sounds found. Lung sounds are clear. So after the lung assessment, I am going to do the cardiac assessment. With the cardiac assessment, I am also going to do a CVA cardio. I'm going to do a peripheral assessment as well. That involves looking at the hands, feeling the temperature, checking capillary refill, checking for cyanosis, checking for clubbing. I'm doing the same thing on his lower extremities, checking capillary refill, feeling temperature, equal on both sides, warm, checking pulses, distal pulses. Okay, checking pulses here again, brachial pulses. Okay, and next I am going to do I'm going to do an assessment of the heart. I'm inspecting, I'm looking for even color. I am looking for any signs of stenosis, looking at the lips, looking at the ears, looking at the tip of the nose. Also, I can look at the sacral area to see if there's any edema. There is no edema. There is no peripheral edema. So I am next going to percuss the precordium. And to do that, I am placing my hand, I'm starting at the apex. Okay. While doing this, I am also checking for the apical pulse present at the fifth intercostal space, mid-clavicular line. Okay. I am feeling for any heaves, any thrills, any murmurs, any rubs. Okay. None of those findings are present. Okay. Next, I am going to percuss the area. Now I'm going to check. I am going to check the the heart sounds. I am again identifying. I am identifying the apical pulse. Okay. I am going to auscultate starting at the mitral area. Okay. Tricuspid. Okay. Pulmonic. Aortic. Herb's point. Okay. Again, checking these pulses, I am checking rate, rhythm, and intensity. Okay. So after the assessment of the heart, I am going to do the abdominal assessment. I'm going to have him. I'm just looking first. I'm looking at the abdomen. I'm just looking at the abdomen, looking for any visual changes, looking for any discoloration around the umbilicus. I'm looking for any skin changes, any scarring. None of that is present. I'm going to have him lay down, lay back. Okay. Okay. Ideally, in this situation, the knees should be bent. But here I am going to start with the abdominal assessment. I am going to auscultate the abdominal quadrants, listening for the vowel sounds. Identifying any hypo or hyperactive sounds. Okay. Also going to auscultate the aorta, renal arteries, left and right, iliac arteries, left and right. Okay. Femoral pulses. Okay. Next, I am going to perform the percussion. Next, I am going to do the palpation of the abdomen. I'm palpating in all 9 regions. Next, I am going to do the percussion. I'm going to do light percussion all over the abdomen, all 4 quadrants. Okay. I am looking for any rigidity. I am looking for any signs of pain, tenderness, feeling for any lumps. Okay. And next, I am going to do. I am also going to percuss the liver to identify the size, starting from the top. Okay, I percuss till there is dullness, and I mark that area. And from below, I percuss till there is sound change, and I am going to mark the area and measure the liver span. And that is, the normal is 6 to 12 centimeters. His is within normal. I'm going to do the same thing on the left side. I'm performing the percussion on the left side. Okay. Okay. And spleen is percussed at in between 6th to 9th intercostal space. Okay. Next is the palpation of the abdomen. Light palpation all over. Okay. Feeling for masses, feeling for rigidity, tenderness. Next, I am going to do the depalpation of the liver, placing one hand under the liver, pushing that area up. Doing deep palpation of the liver, feeling the edges of the liver, feeling for any lumps or masses. Okay, going to do the same thing on the left for the spleen, deep palpation, placing one hand under the spleen area, palpating. Spleen is not palpable, normal finding. Next, I am going to palpate the kidneys. I'm going to put one hand under and deeply push the kidney area up and do deep percussion of the kidney. Okay, going to do the same thing for the left side. Pushing the flank area up from the bottom and doing the deep percussion. Deep palpation of the abdomen. Okay, so that is normal. Okay, you to go ahead and stand up. I am also, while I'm on the back, I'm going to have him turn back. I am checking the flank area for tenderness, placing a hand here and striking against it. Okay, with the ulnar surface. Feeling for any tenderness. Is there any tenderness or pain?
No.
No. Okay, so the flank area is non-tender. Next, I am going to, I am going to assess his lower extremities. At the lower extremities, I am noticing color of the extremities, noticing color, hair distribution as normal, male pattern. Checking distal pulses, the tibial pulse, dorsalis pedis, noticing rate, rhythm, and intensity. Popliteal pulse, doing the same thing on the right side. Okay, tibial pulse, dorsalis pedis, pulses are normal. Capillary refill is normal. Extremities are warm. Okay, while I'm at the extremities, I'm also going to check the range of motion. Okay, 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 okay. I'm also going to check his reflexes. First, I'm going to check the patellar reflex. This should be just a slight movement. Okay, on the right. Okay. Okay. All right, patellar, left and right patellar. I'm checking the Achilles. Okay, right and left. Okay. Okay. All right. Now I am going to check. I'm feeling for the carotid pulse here. Okay. Okay. Noting the rate, rhythm, and intensity. Also going to auscultate the carotid pulse. Hearing for any bruits. No bruits heard. Okay. Okay. I am also the neurological assessment. I have already checked the cranial nerves. I've checked his. I've noticed his gait, his movements. I'm going to check the fine motor. I'm going to do a fine motor assessment. I want you to do this. Okay. I want you to touch your nose. Okay. Touch your nose and raise your arm to the left. Okay. I want you to touch this here. Touch my finger with yours. Okay. Okay. So the fine motor assessment is normal. Next, I am going to the genital or the genitourinary assessment has been deferred, and so this is the end of my assessment. Thank you for listening.